So no, not all numbness and tingling is the result of a blown out disc, and not all weird sensation in the lower half of the body is the result of sciatica. I'm Dr. Matt. I'm a sports chiropractor here at Summit Sports Chiropractic, and today we're going to be diving into one of the more sneaky culprits that could be causing pain, numbness, tingling, pins and needles, or paresthesia sensations in the body, or even weakness. We're going to talk about peripheral nerve entrapments. First off, what are they? Well, as the nerves travel throughout the body away from the spine, they get trapped or compressed in different areas of the body, and that creates a peripheral nerve entrapment. Well, what causes it? It can be anything from tight muscles, scar tissue, repetitive motions, pregnancy, and sometimes even traumatic injuries will cause these peripheral nerve entrapments. If you think of it as a garden hose flowing from the spine to the fingertips and the toes and everywhere else throughout the body, as that garden hose gets compressed, that nerve signal transmission goes down, and that translates directly into pain, numbness, tingling, weakness, paresthesia. So some of the most common sites for that are the median nerve, which is going to run through the elbow and into the carpal tunnel and then into the hand. So when that hand starts to go numb or gets tingly after typing or waking us up in the night because we're sleeping like a T-Rex, oftentimes the median nerve is what's compressed. Sometimes we're looking a little bit more proximal to the neck and we're looking at the thoracic outlet, where we have the brachial plexus that comes out and we have a bunch of muscles in here that sometimes can get tight and inflamed. We can also sometimes have what's called a cervical rib or a riblet. So our ribs attached to the thoracic spine from T1 to T12. Some people have a normal anatomical variance called a cervical rib, where C7 has a little riblet that sticks out. Most people don't experience anything with it. Some people, it'll create a little bit of inflammation or create more tension around those brachial plexus nerves, and the musculature create compression. Additionally, we have issues in the lower half of the body around the sciatic nerve. So a lot of people will assume right off the bat, if they're having symptoms in the lower half of the body, it's sciatica. Oftentimes it's because of the lumbar disc. Not always the case. When we look at the piriformis, that's a very easy culprit for compression of that sciatic nerve. If we are getting into a new exercise regimen, if we're running harder or on different surfaces, if we're sitting too much, all of those things can lead to the piriformis tightening down and compressing that sciatic nerve. We can spend all day and night working on releasing the low back. It's not going to do anything if that's not the culprit that's causing the peripheral nerve entrapment. Alternatively, we look at numbness and tingling or pins and needles on the front of the leg, and that's going to be more of our lateral femoral cutaneous nerve, or meralgia paresthetica. That's coming from waistbands that are way too tight, wearing belts that are too tight, sitting for too long, utility belts, things like that. A lot of times we have patients who come in and talk about sciatica on the front of the thigh. Sciatica will never be on the front of the thigh. That's going to be our meralgia paresthetica. And the last one that we're going to talk about is our cluneal nerves. And so that one is going to be from the low back across into the glutes. So we have low back muscles, glute muscles, and then the cluneal nerves that run in between, and they run right over the iliac crest here. Low back muscles get tight, glutes get tight, and like saran wrap, they pull that nerve right up against the iliac crest, create a little bit of friction, a little bit of compression, a little bit of irritation. What does that turn into? Pain, numbness, tingling, paresthesia. Most commonly brought on from increase in running, heavy impact, sitting too much, changes in exercise programming, or not relaxing or stretching or doing enough mobility work in the low back and pelvis. So as you might have noticed, there's a trend with a lot of these. They can be positively impacted or even mitigated with proper mobility work, stretching, breaking up your repetitive activities and habits. However, if information is getting to you a little bit too late and you're already dealing with these issues, don't worry. We have tools and resources that can help you out. At Summit Sports Chiropractic, our top priority is getting to the bottom of what it is that's causing this issue. So like I said, we're not chasing issues in the forearm when maybe your issue's at the thoracic outlet. We're not chasing issues at the cervical spine, but maybe your issues are down here, right in the wrist. We're going to spend time figuring out what's going on, so we're not going on a wild goose chase together, wasting each other's time. Once we figure out what's going on, we're going to make up a treatment plan that includes soft tissue treatment to loosen up those tight muscles, specific exercises like nerve glides to help free up that tissue and allow that garden hose to flow properly, and adjustments to the joints to help keep that overall movement in the region as ideal as possible. Now, if this sounds like something that you're dealing with or someone you know is dealing with, please reach out, give us a call. We're happy to help. We're here to help you move better, feel better, and live better.